Hi everyone, in this video we are going to learn about Nipah virus. As we already know, as currently that is in September 2023, there is outbreak of this Nipah virus in the Kerala. So this is a very important topic and we should know about this. In this video we are going to see about introduction, outbreaks, how the virus is transmitted, what are the signs and symptoms, how to diagnose the patient, how to collect the sample, what are the case definitions, how to treat, and few points on prevention and precautions. So let's begin with the introduction. So the Nipah virus infection is basically a zoonotic disease of a public health importance in Southeast Asia region. The Nipah virus is named after a Malaysian village called as Kampung Sungai Nipah, where it was first discovered. This Nipah virus belongs to family Paramyxoviridae and genus Nipah virus. This Nipah virus was first discovered in 1999 during an outbreak among the pig farmers in Malaysia. Then later on, subsequent outbreaks were reported in Bangladesh and India in 2001 and 2008. Let's know some facts about outbreak in India. India confirmed its first Nipah virus outbreak in Siliguri in West Bengal in 2001, as we have already seen. The second outbreak was in Nadia district in 2007. Just look at the table. In February 2001, there was outbreak in Siliguri, India. Total number of cases were 66, out of which 45 patients died. The case fatality rate was 68. In April 2007, the outbreak occurred in Nadia district in India, where total 5 cases were there and all of them died. Similarly, in 2018, 2019, 2021 and currently, all the outbreaks are in Kerala. Currently, there are 5 cases, out of which 2 patients already died. So now let us see about the transmission of this virus. The human infection in the first recorded outbreak resulted from contact with sick pigs, exposure to secretions from pig, or unprotected contact with the tissue of the sick animal. In subsequent outbreak in Bangladesh and India, the consumption of fruits or fruit product like raw date palm juice contaminated with urine or saliva from the infected fruit bats was the most likely source of infection. So the first outbreak was due to contact with pigs, but later on, and like countries like Bangladesh and India, it was due to infected fruit bats. The human-to-human transmission of Nipah virus reported among family and caregivers of the infected patients. So human-to-human transmission can also occur. This is the diagrammatic representation of the same. That is, there is fruit bat which contains this Nipah virus, and the secretion from these bats like saliva, urine, or blood. If the pig get contact with this, then it infects the pig, and through pig it can infect the human. Or human can also be directly get infected by consumption of fruits that are contaminated directly with the saliva or urine of fruit bat. And also, just now we saw that human-to-human transmission is also possible. Hence, the triangle is bats to pig, pigs to human, bats to human, and human to human. All of this is possible. Now, few points on the natural host of the virus. The fruit bats of family Pteropodidae are the natural host for Nipah virus. Apparently, there is no disease in the fruit bat. Now, we saw that the Nipah virus does not cause any disease in the fruit bats. But what about the domestic animals? So, the outbreak of the Nipah virus in pigs and other domestic animals such as horses, goats, sheep, cats, and dogs were first reported during the initial Malaysian outbreak. It was noted that it is highly contagious in pigs. In acute illness, it is mostly asymptomatic in these animals, but it can cause labored breathing and neurological symptoms such as trembling, twitching, and muscle spasms. Unusual barking cough, called as barking pig syndrome or the porcine respiratory and encephalitis syndrome, is caused by this Nipah virus in the pigs. Now let us look at the signs and symptoms of this disease. The human infection ranges from asymptomatic infection to an acute respiratory infection, which can be mild to severe and fatal encephalitis. So in pigs and in humans, in both it involves respiratory system and neurological system. The incubation period ranges from 4 to 14 days. The initial symptoms are fever, headache, cough, sore throat, difficulty in breathing, and vomiting. So the respiratory symptoms are the initial symptoms. In severe cases, the severe symptoms may follow such as disorientation, drowsiness or confusion, seizures, coma, and brain swelling, that is encephalitis. So the neurological symptoms occur late and in severe cases. It starts from respiratory symptoms and then in severe cases it lands into encephalitis. The long-term side effect in the survivor of Nipah virus, that is those patients who did not die and anyhow survived the infection, there is persistent convulsions and personality changes. Now, how do you diagnose this infection? It is challenging due to non-specific early symptoms of the illness. As we have already seen, it is mostly fever, cough, headache, sore throat, and vomiting. We can do RC-PCR from the samples collected from the throat and nasal swabs, CSF, urine, and blood of the infected patient. We can also do antibody detection via ELISA, and also there are other tests like PCR assay and virus isolation by cell culture. Now, few points on sample collection. Nipah virus is considered as BSL-4 agent. that is biosafety level 4. There are only 4 gradings of biosafety level: 1, 2, 3 and 4, and 4 is considered the most hazardous one. Ebola is also an example of BSL 4 agent. Hence, while collecting the sample, universal standard droplet and biocontaminant precautions should be followed during the contact with the excretion, secretion and body fluids of the suspected patient. The throat swab should be collected in the viral transport medium, urine approximately 10 ml in the universal sterile container, blood in the plain vial at least 5 ml, CSF at least 1 ml in the sterile container. The sample should be collected as early as possible, preferably within 4 to 5 days on the onset of symptoms. The sample should be packed in triple container packing and should be transported under cold chain. The outer surface of the container should always be disinfected using 1:100 dilution of bleach or 5% Lysol solution. Now let us see what are the case definitions of Nipah virus. That is, when do you call a suspected Nipah virus, when do you call a probable Nipah case, when do you call a confirmed Nipah case. Basically, during Nipah virus outbreak in a particular community, any person having fever, headache, cough and altered mental status should be considered as a suspected Nipah case. Now what is probable Nipah case? A probable Nipah case has two definitions, 1 and 2. A suspected case or patient who resides in the same village or ward where a suspected or confirmed case of Nipah virus were living during the outbreak period and who died before complete diagnostic specimen could be collected, or a suspected or patient who comes in direct contact with a confirmed case in a hospital setting during the outbreak period and who died before complete diagnostic specimen could be collected. So when do you call a confirmed Nipah case? A Nipah virus RNA is identified by PCR from respiratory secretion, urine or CSF. Now let us see when do you call a contact. That is, what is the definition of a contact. A close contact is defined as a patient or a person who comes in contact with Nipah case, confirmed or probable, in at least one of the following ways. Remember, it also includes probable cases. So if a patient was admitted simultaneously in the hospital or ward or shared a room with the suspect or confirmed Nipah case, if a patient had a direct physical contact with the suspect or confirmed case of Nipah during the illness, if it had a direct contact with the deceased of suspected or confirmed case of Nipah, or at a funeral or during the burial preparation ritual, or a person who has touched the blood or body fluid, for example saliva, urine and vomitus of the suspected or confirmed case of Nipah during the illness, or a person who has touched the clothes and linens of a suspected or confirmed case. So it includes suspected as well as confirmed case, and any contact with the patient or deceased who is suspected or confirmed case. This contact needs to be followed for appearance of symptoms of Nipah virus for longest incubation period, that is 21 days. Now what is the treatment of Nipah virus? Currently there is no treatment available for Nipah virus. You have to treat the patient based on symptoms and supportive care has to be given, including rest and hydration. Immunotherapeutic treatment such as monoclonal antibodies currently are under development. The drug like ribavirin was used to treat small number of patients during the initial Malaysian outbreak, but its efficacy in the patient is unclear. So now, how to prevent the transmission of Nipah virus? This can be done by 3 ways: reducing the risk of bat to human transmission, reducing the risk of animal to human transmission, and reducing the risk of human to human transmission. Remember, we saw the triangle. Now how to reduce risk of bat to human transmission? A freshly collected date palm juice should be boiled and fruits should be thoroughly washed and peeled before consumption. Fruits with signs of bad bites should be discarded. Now how do you reduce the risk of animal to human transmission? Avoid being in contact with the infected pigs. Protective clothing should be worn while handling the sick animals and their tissues and during slaughtering and killing process. Reducing the risk of human to human transmission, unprotected physical contact with Nipah virus infected people should be avoided. Regular hand washing should be carried out after caring or visiting a sick people. Now what are the other precautions that can be taken care of? Avoid consumption of toddy. It is a local liquor that is collected from the area where fruit bats are found in plenty, as the beverages is brewed in an open container. So there is risk of contamination by these fruit bats. Wear mask and gloves while attending the patient and wash hand using antibacterial soap or liquid if you happen to make any physical contact with the infected person. The wells and other water sources should be kept closed to avoid the entry of the bats. And also the treated water should be used for body sanitization and cleaning, and for consumption purposes you should use boiled water. Now moving a suspected or confirmed patient to other location could result in spreading of the virus, since it is a transmittable disease. Hence there should be minimal mobility and quarantine is advised. And lastly, monitor if anybody in your family shows the symptoms of flu. Avoid self-treatment and do check with medical professional. Do not panic, as sudden influx of fear could only worsen the situation. So that is it for the video, guys. Thank you so much for watching the video, and share this video with all your friends and colleagues, and do subscribe the channel.